Okay, so far we spoke about what blood pressure is and how you take it and why I'm a little bit against the carrying the machine. And it's not so much I'm against it, it's that the information is a little bit not really useful, and it's a little bit another piece of gear and things like that. So it's good to have, but if you don't have it, you can do it without it. And so we were explaining a little bit the differentiation of the blood pressure. And here's where we're going to go a little bit more in details. And if you do going to if you're going to carry it and take it, the numbers, it's not actually so much the numbers that you get that it means, but the other calculation that you can get from those pressure that are more sensitive to what you need to know. And I'll explain that a little bit more in details. So like we were saying, we have two categories: low blood pressure and high blood pressure. We'll continue in the high blood pressure because we were already talking about. So we can have the acute and the chronic. So acute blood pressure, and the numbers here, we won't talk much about it because it depends on where you read and what you read and everything, but we're just going to talk about it a little bit. There's a lot of things that can bring your blood pressure up. Stress, fatigue, being sick, a lot of those things can bring your blood pressure high just on the moment. So that means like acutely. Chronically, you can also have high blood pressure because you have arterial sclerosis, because you have other kidney function not properly. You can have diabetes, and another one that sometimes can go to high blood pressure, or high blood pressure and diabetes can kind of worsening and everything. So there's a lot of reason that you can have the chronic. So for the self-reliance medicine part, the issue with the chronic one is that, let's say you don't know that you have high blood pressure for whatever reason. You never seen the doctor or whatever or something, and then suddenly you're starting to get blood pressure. Well, when people are diagnosed for high blood pressure, they usually recommend to go see their family doctor on a regular basis, and even actually to take your blood pressure, because there's what they call the white coat syndrome. So that means just yourself to go to the hospital, your blood pressure will be higher. And that's why all those blood pressure came to the pharmacy and everything. So what they recommend is that you take with the same machine at the same time every day for a period of time, 2 or 3 months, 4 or 5 months. And if it stays high, then yes, you do have blood pressure, and it's not just an acute phase, it's mostly a chronic problem. The chronic problem is themselves, so that you have higher blood pressure, and we'll talk a little bit more about the acute, but just that you have, let's say, chronic and you have no symptoms as per se, so you don't have major headaches, you don't have any chest pain or anything like this, which we'll talk more about the acute again, so just bear with me here. So if you don't have the chronic, the hypertension itself is not an issue. At the long term, as a chronic problem, yes. Why? It's because that, like we were talking about it, that pipe, because it hits hard and hard and hard and hard with higher pressure up to here. At one point, there's complication that can come with it. You can have complication to the brain, because the brain will kind of shut down. You can have complication for the kidneys. You can have a risk. So hypertension is a risk for other disease, cardiovascular disease mostly. So strokes, MIs, and kidney failures. They're at risk for that because of their hypertension. So if we can maintain their blood pressure lower, then they would be good. But not in the acute phase. At the long run, we're talking about 5, 10 years. That if we don't control it for a period of time, yes, people will die. Not so much of the hypertension, but of the complication of the hypertension. That's why we treat the hypertension, because that's the first symptoms that would kind of run out and stuff. So that's why. At the chronic phase, on the self-reliance side, even if you diagnose someone with hypertension for whatever reason, there's nothing you'll be able to do to treat the chronic part of it, we're talking about trial of different medication, trying different things, changing the diet, multiple visit at the doctor's, blood work, and everything. All things that in self-reliance stuff is not feasible. So even if we saying that hypertension, as per definition, is a blood pressure of 140 over 90, which was one of the things that I was kind of against in the book of the Bloom and Doom thing, is that, yeah, okay, sure, that is a little bit of hypertensive, but right now I'm not treating this. Because even if I treat it, like in the self-reliance medication where there's no hospitals, there's no treatment, what medication I'm going to give, which one I'm going to try. There's different type. This depending on your past medical history, depends on what it is, the cause of it. Is it your high salt diet? Are you changing your diet and everything? So even if you treat this, it will take a period of time. So carrying all the medication and everything and plus, don't forget that to have this, you have to have the extra blood pressure cuff, is not very useful. Anyway, in my opinion, because of this, because things that can happen, so let's say that whatever situation that creates that you'll be in the self-reliance medicine for over a year, they're still not, just change your diet and hope for the best in a way, but there's no medication because you don't even know which one to take, and to carry all those medications would be kind of irrelevant. So carrying the blood pressure cuff just for that is a little bit of not useless. It's kind of useless actually. So that's why I don't recommend it. So now let's go back into the two others that it could be useful. So this one, not very useful. Let's go on the other one. So acute. So that means that you have very high blood pressure, and again, because you're sick and everything. So as you get less sick, you'll get less acute. Well, if you're acute with symptoms, so that means, let's say my pressure, usually, I don't know, it's 130 over 80. Well, because I'm sick, I get 160 over 90. Okay, 160 over 90, but I got headaches and stuff. Well, okay, just treat my symptoms and treat my disease and my pressure will go down. But I'm very unlikely that I'm going to have a stroke because I got a pressure 160 over 90 for a period of time. The point is, though, is that if you have a blood pressure of 220 or a systolic greater than 120, this is called an emergency hypertensive crisis. And that, if you ever come, that is your first time, never time, then you're known hypertensive, if you have that blood pressure, we will treat that, because that means that the pipes are so much under pressure that they may burst, and then you have a risk of a bleed. Okay, so at that level, sure, okay, we can start treating. But again, let's wait for a second. There's some literature that supports, and actually a lot of, now it's the new guidelines, if you have a high blood pressure in a case of a stroke, so that means you had a stroke or any head injury, we do not treat the blood pressure anymore unless we're going to give you medication to break the clot, or if it's caused by a clot, because 85% of the strokes are caused by clots. The other 15% is caused by bleeds. So if you come with a medication, a cause that could be a clot, and we're going to give you medication that means that it's going to break all this, then we will bring your blood pressure down to give you that, to decrease the risk of bleeding over your blood. But again, in the self-reliance situation, very unlikely that we're going to treat that. So, okay, again, would be good to know, but not, because I would have other signs and symptoms. So if we're talking about stroke, I would have the numbness, the tingling, the facial droop, the chest, and we'll do, I think, one on the neuro emergencies in the future, and so I would have those symptoms. So I don't need, again, piece of the puzzles. Yes, the blood pressure would be fun, would be good to know, but not a big piece on my treatment, because the treatment that I would be able to give in the self-reliance would be limited for whatever I can give. I wouldn't be giving thrombolytic into a patient with stroke. If you have those medications, then therefore most likely you do have the skills that comes with giving that medication, and as well you have the gear. Therefore that part that I'm saying, you wouldn't be watching this video, you would be doing your own stuff. So that's what I'm saying. So I'm talking about people, not of medical training, that are trying to take hard decisions. So even if I have those big numbers, don't mean much for an acute phase, which would be an hypertensive crisis. If someone comes with signs and symptoms of chest pain, shortness of breath, there is things that you could treat with, and one that we could find in the self-reliance medication. And again, I do not give medical advice or contain anything, but nitro used to lower blood pressure. So in this case, maybe we'd be able to use nitro in that. But again, it would be your decision. If you have the nitro, if you're able to carry those nitro, that could be one that you could maybe control their blood pressure with. But again, would you want to do that blood pressure? That is up to you. But that would be one of the things, and you would have other signs and symptoms. You would have chest pain, you would feel sad. So all those symptoms would tell me there's maybe something wrong with the blood pressure. One way of making the difference between those two, because I mean, if I have low blood pressure, I can also have a headache, feel dizzy and everything. Well, this one I would have more signs of shock, so that means my skin would be either diaphoretic, I would be kind of decreased level of consciousness, I would have, could have chest pain in both places, I could feel like crappy and everything. But in this one, if I take the pulse would probably feel boom, boom, because again, it gets shooted at this. So by taking my pulse, usually what I do is I put it on the scale of 3. So a regular pulse would be 3 out of 3, up to 1 out of 3, but meaning that you barely feel it. Well, that means that if I have a pulse a bounding pulse that we feel, so that means I feel it. That means that my pressure is probably through the roof because of this, because I'm feeling the symptoms. So that could give me that little part that I don't need to carry a big machine that can break down in all the symptoms that we were talking about. And the low blood pressure part, well, again, the pulse can be significant, and just by taking a good pulse in radial pulse, do I feel any pulse over there? If not, then I have sinus shock. Then I have low blood pressure. I don't need to have a blood pressure to tell me that. I don't need a blood pressure to tell me that I got 80 over 40 to know a blood pressure. So what? Okay, I got a pressure of 80 over 40. I still need to treat this patient just like if I would see or this person just as I would see it. So I don't need the blood pressure to tell me what it needs to be done. So this is my reasoning about all blood pressure. One thing that a lot of people don't talk about, and I'll put a link down, and I'll talk quickly because I see that the time is kind of running out. It's called pulse pressure and MAP. MAP means mean arterial pressure. And basically what you do is systolic plus 2 times the diastolic, and you divide that by 3. That number has to be between 60 and 65, and it's way more reliable than any number that I can give you. 130, 140, 150. Doesn't mean much, but this number will always be. So if you have whatever your blood pressure, but you have a MAP of 60, and I have a MAP of 60, so it's a little bit like a converter that we speak the same language with that number. The other one's called the pulse pressure, and it's easy. You take the systolic minus the diastolic. If it's less than 25, this person is mostly in shock, and that's there's literature that support that, and again I'll put some links there. If it's greater than 100, it's called widening pulse pressure, and there's also complication with that, and there's also literature to support that. Anyway, so those are my two-part video on blood pressure. If you have any questions or anything, don't hesitate to call me, and we'll talk to you soon.